Hello, welcome to my presentation. My name is Misouri Alatorre, and today I will be presenting PKAN disorder. PKAN, which stands for Pantothenate kinase-associated neurodegeneration, also formerly known as Hallervorden-Spatz syndrome, is a neurodegenerating brain disorder that causes the accumulation of iron in the brain. The iron accumulates mostly in the basal ganglia region, which results in a progressive degeneration of specific regions of the central nervous system, in most cases specifically the lower part of the brain. This disease is difficult to account for, but the Book of Genetics of Movement Disorder claims that the general population rate of gene carrier is approximately 1 in 275 to 500 people, and it has a rate of 1 to 3 in 1 million of observed cases, also counting the misdiagnosed and missed cases. The cause of this disease is hereditary, by having two parents with a carrier gene. Both PKAN carriers have a 25% chance of a child with PKAN, 50% that a child is a carrier, and 25% that he will not have PKAN or be a carrier. Most specifically, if a parent has a mutation in chromosome 20, autosomal, then they have a mutation in their chromosome gene PKAN2. This mutation in the genes affects the ability of the cells to turn vitamin B5 into the energy for the body's metabolism into essential chemicals. Research is still being done. It is still unknown how the presence of PKAN2 and the inability to turn vitamin B5 leads to the accumulation of iron. The degeneration is rapid, and it is visible in children starting from the ages of 3 to 6 years old, and their MRIs of PKAN patients are very recognizable. The swelling in the globus pallidus and the iron in X-rays is often called the eye of the tiger. As you can see, the dark areas dense in iron give it that shape. This disease has internal and external characteristics. Patients may experience dystonia, involuntary muscle contraction and spasms. Some experience chrenia, which affects the upper part of the body such as the head, the neck, and the mouth. And some can experience limb dystonia, affecting their extremities such as the arms and the legs. Some patients will experience dysarthria, spasms, in the muscles of the tongue, the larynx, and the vocal cords, affecting their speech and the ability to eat and swallow. One of the other characteristics of PKAN is the spasticity, or tightness of the muscles. Some experience hyperflexia, which means overactive muscles, and many children can experience developmental delays and attention deficits. Unfortunately, most of these symptoms cause a patient's bodies to move in ways that are painful, and some children show rapid degeneration and won't live for more than 1 to 2 years. Some patients can live longer if their disorder symptoms plateaus. All PKAN patients experience different symptoms and vary in severity. More research still needs to be done, but some researchers suggest that due to the movement restriction, intellectual delay is part of the condition. There are two types of classifications. One is classic, and the other one is atypical. But atypical is usually for patients with severe symptoms that also include depression, impulse, and outburst disorders. Classic is also usually for patients in their first years of life. There is currently no treatment for PKAN. However, there are medications that can help with the symptoms. Botox can help with muscle relaxation. Some benefit from brain stimulation through implants, and many patients use different types of therapies to help with muscle spasms and flexibility. One of the most common ones is adapted aquatic therapy. We have come to the end of my presentation. In the next slide, you will find my references. Thank you all for watching.